participation, your active participation in VACCELERATE. It's a great pleasure not only to me but also for everyone in the VACCELERATE consortium to be here today. So, yeah. VACCELERATE is a European corona vaccine trial accelerator platform. These are my disclosures. It's a pan-European backbone accelerating platform for phase 2 and 3 clinical trials. We started with COVID-19 vaccines, but considering the huge effort we have done, well, we thought it was relevant to keep going after the pandemic and after the huge impact of the COVID-19 vaccines. It is the largest clinical research network for vaccine trials in the whole Europe, not like the European Union, but the whole Europe as a continent, with 29 partners in 18 EU member states, of course, including the Czech Republic and 5 EU associated countries. We received an initial funding of 12 million euros, and afterwards, top-up funding of 14.5 additional million euros. This was so we could perform and run our
Sorry for the interruption.
So, as I was saying, we received an additional funding so we could run our own clinical trials as sponsors. I will speak about them later. And we are part of the European Commission pandemic preparedness. In VACCELERATE, everything started here in September 2020 with UBAP. UBAP is an online registry for clinical trial sites. I will provide further details afterwards. It was originally set in Germany and it was funded by the German Center for Infectious Diseases Research and the German Federal Ministry for Education and Research. After 1 month, we had already more than 100 sites registered, and at that moment we were suggested to do, let's say, the same thing for people. Online registry for people that were willing to participate as volunteers in clinical trials. We set it initially only for Germany, and after 1 month we had more than 10,000 volunteers registered from Germany. In that time, we also submitted an expression of interest to the European Commission. In January 2021, we submitted the full proposal, and in February 2021, we had the grant agreement signed. There was an amendment, so we could perform our own clinical trials as sponsors, and then regarding the clinical trial site registry, after 1 year since we set it up, 470 sites were registered from the whole continent, from the whole Europe. Regarding the VACCELERATE volunteer registry, we expanded. It was not only available in Germany, but in 9 additional countries in November 2021. We will give you the updated numbers in the following slides. In VACCELERATE, we have 7 objectives: platform building, capacity mapping, capacity building, volunteer registries, laboratory access and assay standardization, solutions for vaccine development issues, and the development and conduct of academically driven phase 2 and 3 vaccine trials. This objective we do with the help of 4 different measures, which are pandemic preparedness, vaccine trial design, vaccine trial conduct, and vaccine trial infrastructure. Here below, you can also see which are the different work packages of the VACCELERATE consortium. And regarding our internal infrastructure or structure, actually, we have the VACCELERATE coordination board, where the different work package leaders are represented. We have, for example, the coordinator, which is Oliver Corneli, and also, for example, Jack Demott, who was speaking just before. And additionally, there is always one national coordinator representative, which in the current in the current moment, is Pontus Nampler from Karolinska Institute in Stockholm. And also we have VACCELERATE national coordinators, which in the case of the Czech Republic is Peter Husa from here, from Brno. The first step or the first tone of VACCELERATE was, or we could say it was the clinical trial site registry, and it's with the objective of capacity mapping. You can have the full explanation and very many details in jubab.eu. And the added value of this clinical trial site registry is that it's a transnational capacity questionnaire for clinical trial sites in Europe. Basically, what we do is, in this online survey, we ask for which are the available infrastructure and which is the experience these clinical trial sites have. We ask for the contact details, for the prior clinical trial experience, also for their available infrastructure, and the preferred parameters regarding potential participation in clinical trials. The next steps are the promotion and dissemination in Eastern Europe, especially in countries that don't belong to or are not part of VACCELERATE. And how does it work, the participation in jubab or in the clinical trial site registry? It's really easy, and I will guide you through it. So we have the website, jubab.eu. There, sites can register and provide their full information, which will be stored and saved in the service or in the software. Then one day we will be approached by institutions or by entities interested in running clinical trials and looking for clinical trial sites. Then we will match the study. We will match these clinical trial sites with the requirements and needs from the sponsors and the institutions and entities looking for clinical trial sites, and we will inform the sites registered in jubab. And then they autonomously decide whether they want to participate or not, and well, eventually they might, there might be a match between the clinical trial site and the sponsor looking for sites. So far, we have sites in 39 countries, a total of 475, of which 384 are interested in running clinical trials in adult population and 230 in pediatric trials. If we look closer to the Czech Republic, we can see how we have one center, one clinical trial site in Brno, one in, sorry for the pronunciation, Hradec Králové, another one in Olomouc, 2 in Pilsen, and 3 in Brno. And this is how it's been the enrollment of sites for you. The progress and site aspects of this clinical trial site registry is development of VACCELERATE training curriculum. We give the opportunity to do GCP training, also vaccine trial course, multinational trial course. Also, we have courses for study nurses. And also we are digitizing training content in a platform where well, everything can be uploaded, and that way we can see with much more detail which are the actual capacities of the respective sites. Another interesting part of VACCELERATE is the volunteer registries. You can access to them through the link in the slide. And the added value of these volunteer registries is that it's the only transnational volunteer registry in Europe, not only for COVID-19 vaccines, which was, of course, the original aim, but now it's open to any clinical trial. There we collect different data, which are basic for the filtering of the patients and for their participation in a potential participation in a clinical trial, data such as the demographics, whether they are adults or children, underlying conditions, because we don't look only for healthy patients, but also for any kind of patient with any kind of underlying conditions, infection, and also current status of COVID-19 vaccination. The next steps here in the volunteer registries are the promotion and the dissemination, including patient advocacy groups and underrepresented groups, because we look for everyone, anyone is welcome, and also we expect increasing registration over the next 3 months because there are still some countries pending to be activated with their local version of the volunteer registry, and also some of them are working in promotional process. So far, the registry is active in the countries that are colored in dark green: Austria, Cyprus, the Czech Republic, Germany, Greece, Ireland, Israel, Italy, Lithuania, Portugal, Norway, Spain, Sweden, and Turkey. And we are in the activation process of the volunteer registry in 3 additional countries: the Netherlands, Belgium, and Hungary. We are in a cooperation with a volunteer registry that was set in France before VACCELERATE existed, with COVID-19, and this is how it works. It's very similar as for the clinical trial side. The person, a volunteer, a person that is interested in participating in a clinical trial, they go to wrong slide, but basically you go to vaccelerate.eu/volunteer-registry. Let's say that here it says what I have said. Then their data are saved in the software, and then one day we are approached, VACCELERATE is approached by a clinical trial site looking for people potentially interested in participating in a clinical trial. They provide us a list of participation criteria, and then we filter the patients based on those criteria provided by the clinical trial site. And then, and the patients autonomously need to decide whether they want to participate in this clinical trial or not. We don't have knowledge of this eventual participation because we don't really have the option to know that according to our ethics approval. And and basically that's it. Eventually, if they don't participate in this one, they might be contacted for another one, and in any moment they can remove their participation because it's their data and it's their decision. And this is how it looks as of today, the progression on the number of participants. So far, we have almost 40,000 participants in all the countries where there is an active volunteer registry. And the next steps here in the VACCELERATE volunteer registry are basically 3 with different aspects. The first one is registry capacity building, basically the activation of the registry in the pending country. I mentioned Belgium, Netherlands, and Hungary. Also, the inclusiveness of volunteer registration. All the patients are welcome, healthy patients, non-healthy patients, everyone, adults, kids, and also the transformation of the registry into a longitudinal cohort. Basically, this means that the volunteers, in the current moment, in case they want to change any of the information provided, they need to do it through us, sending us an email. But we will change this procedure so they can have login details and they can change manually whatever information it changes from them. For example, a woman can get pregnant, or another person might have get an additional vaccine dose of COVID-19 vaccine, or whatever. Then, to increase the awareness, clinical trial literacy, and community engagement. This we will do with promotional campaigns and dissemination of the VACCELERATE toolkit, which basically are posters, educational cards, and videos, and all of them, they might be focused in different audiences so they can get the message in the best manner possible. And also the assessment of promotional and educational materials. We are in contact with other people that know or that have experience in such process, so they can guide us and they can give us input so we can proceed in the best manner possible. And again, focus on underserved and hard-to-reach population because we want to include everyone. And last but not least, gap analysis and recommendations. In this process of getting input and improving our registry, we are in contact with certain entities such as patient advocacy groups. And with this, I finished the last part, the VACCELERATE clinical trials. We have 3 clinical trials where we are the main sponsors. The first one is sponsored by the University of Cologne in Germany, and we are focused, or the target population is adults over 75 years old. We already started enrolling patients in November 2021. The second one is sponsored by the University College Dublin in the Republic of Ireland. Its target population is adult population from 18 years old up to 65 years old, and they are also already enrolling patients. And the last one is the pediatric clinical trial. The sponsor is the University Medical Center Utrecht in the Netherlands, and they will start recruiting patients soon. And just to finish, I would like to give a thank you to everyone from the VACCELERATE Coordination Office in the University of Cologne, my colleagues, also everyone in VACCELERATE, especially today Lenka and Peter for inviting us here to present the whole consortium, and thank you very much. And yeah, I know that's not the presentation because I checked online, but yeah, it was really difficult, sorry. Thank you very much.